Have you ever noticed how some people in their 60s move like they are 40, while others struggle to get out of a chair? The difference is not genes or luck. It is what they do in the first 10 minutes of their day. There are 5 specific exercises that tell your body to repair joint damage, instead of making it worse. And the crazy part? Most doctors never mention them. In the next few minutes, you are going to learn all 5. In this video, you will learn a complete 7-minute morning routine that can reduce or even remove joint pain in just 7 days. This is not about pushing through pain or forcing your body to do things it cannot handle. This is about gentle, scientifically proven movements that wake up your joints, bring fresh fluid into them, and tell your body to start healing instead of breaking down. If you are between 40 and 70 years old, and you feel stiffness in your knees, hips, shoulders, back, or hands, when you wake up, this video was made specifically for you. Before we start, I want you to understand that everything you are about to learn is backed by real science. Researchers at Harvard Medical School have studied how joints age and why pain increases after 40. What they found is simple but powerful. As we get older, the fluid inside our joints, called synovial fluid, decreases. This fluid is like oil in a car engine. Without it, your joints grind together, causing pain, swelling, and eventually damage. But here is the good news. Studies published in the Journal of Rheumatology show that gentle movement in the morning increases synovial fluid production by up to 40%. Physical therapists around the world now recommend specific morning exercises to rehydrate joints and reduce swelling. This is not opinion. This is proven science. And today, you are going to learn exactly how to use it. In just a moment, I am going to walk you through 5 simple exercises that target your ankles, spine, shoulders, hips, and hands. These are the exact movements that physical therapists use with their patients who suffer from arthritis, stiffness, and chronic pain. Each exercise takes less than 2 minutes. You can do all of them in bed or sitting in a chair. You do not need any equipment. You do not need to be flexible. And you do not need to be in great shape to start. These exercises work for beginners, and they work fast. If you want to stay active, strong, and independent after 40, 50, or even 60, subscribe to this channel. Also, tell me your age and where you are watching from in the comments. I read and reply to every comment. Now let us start. The first exercise is called ankle circles, and it might seem too simple to matter, but let me explain why this is one of the most important movements you can do. Your ankles are the foundation of your entire body. Every step you take, every time you stand up, every time you walk across a room, your ankles are working. But after 40, most people stop moving their ankles through their full range of motion. We walk the same way every day. We sit for hours, and slowly, the joints in our ankles get stiff. When your ankles are stiff, your knees have to work harder. Your hips have to compensate. Your lower back starts to hurt. It all starts at the foundation. A study from the American College of Sports Medicine found that people over 50 with stiff ankles are 3 times more likely to fall. And we all know what a fall can mean at our age. A broken hip, a broken wrist, loss of independence. But ankle circles can change that. Here is how you do it. Sit in a chair with your back supported and both feet flat on the floor. Lift your right foot off the ground, just a few inches. Now, slowly rotate your ankle in a circle. Imagine you are drawing a circle in the air with your big toe. Make the circle as big as you comfortably can. Do this 10 times in one direction, then 10 times in the other direction. Then switch to your left foot and repeat. The key here is to move slowly and controlled. This is not about speed. This is about waking up the joint, bringing blood flow and fluid into the area, and gently stretching the ligaments and tendons that have been asleep all night. Do this every single morning. If you have trouble balancing, hold on to the sides of your chair. If you feel any sharp pain, stop and consult a doctor. But if you just feel stiffness or tightness, that is normal. Keep moving gently, and within a few days, you will notice that stiffness starts to fade. This exercise is safe for almost everyone. Even if you have arthritis in your ankles, gentle circles can help reduce swelling. The only people who should avoid this are those recovering from a recent ankle injury or surgery. For everyone else, this is a must. Now let us move to the second exercise, which targets your spine. This one is called the cat-cow stretch, and it comes from yoga. But you do not need to be a yogi to do it. You do not even need to get on the floor if that is hard for you. You can do a modified version sitting in a chair, and I will explain both. Your spine is made up of small bones called vertebrae, and between each bone is a disc. These discs are like little cushions filled with gel. They absorb shock when you move and keep your spine flexible. But here is the problem. When you sleep, especially if you sleep on your back or side, for hours without moving, those discs lose water. They shrink. They get stiff. That is why so many people wake up with lower back pain. A study published in the journal Spine found That gentle spinal movement in the morning helps rehydrate those discs and reduce pain by up to 30%. In just 1 week, the cat-cow stretch does exactly that. Here is the traditional version. Get down on your hands and knees, on a soft surface like a yoga mat or carpet. Your hands should be directly under your shoulders, and your knees should be under your hips. Start by slowly arching your back, like a cat stretching. Let your belly drop toward the floor, and lift your head and tailbone up toward the ceiling. This is the cow position. Hold this for 3 seconds, while you take a deep breath in. Then, slowly round your spine the other way, like an angry cat. Tuck your chin to your chest. Pull your belly button toward your spine, and round your back up toward the ceiling. Breathe out as you do this. Hold for 3 seconds. Then repeat. Do this 8 to 10 times, moving slowly and breathing deeply with each movement. If getting on the floor is difficult, you can do this sitting in a chair. Sit up tall with your feet flat on the floor. Place your hands on your knees. As you breathe in, arch your back and lift your chest forward. As you breathe out, round your back and tuck your chin. Same movement, just seated. This exercise is incredibly powerful for anyone with lower back pain, stiffness, or tight hips. It wakes up your entire spine, brings fluid back into the discs, and gently stretches the muscles along your back. Do this every morning, and you will feel the difference in how you move for the rest of the day. The only people who should be cautious are those with severe spinal conditions, like herniated discs or spinal stenosis. If you have these conditions, talk to your doctor before trying this exercise. For everyone else, this is safe, gentle, and highly effective. The third exercise is shoulder rolls, and this one is so simple you can do it anywhere, anytime. But do not let the simplicity fool you. This exercise can save you from years of neck pain, shoulder pain, and even headaches. After 40, most of us spend a lot of time sitting. We sit at desks, we sit in cars, we sit watching TV, and when we sit, our shoulders tend to roll forward. Over time, the muscles in the front of our chest get tight, and the muscles in our upper back get weak. This creates a hunched posture, and it puts a huge strain on our neck and shoulders. A study from the Journal of Physical Therapy Science found that people over 50 who do shoulder mobility exercises every day have significantly less neck and shoulder pain than those who do not. Shoulder rolls are one of the easiest and most effective ways to reverse this damage. Here is how to do them. Stand up or sit in a chair, with your back straight, and your arms hanging relaxed by your sides. Slowly lift both shoulders up toward your ears, then roll them back and down in a smooth circular motion. Do this 10 times, then reverse the direction. Lift your shoulders up, roll them forward, and then down. Do this 10 times. As you do this, focus on making the movement slow and controlled. Feel the muscles in your shoulders, neck, and upper back working. Take deep breaths as you move. This is not just about the shoulders. This exercise also releases tension in your neck, improves blood flow to your arms and hands, and helps prevent conditions like frozen shoulder, which becomes much more common after 50. You should do this every single morning. And honestly, you can do it throughout the day, whenever you feel tightness creeping in. This exercise is safe for almost everyone. The only exception is if you recently had shoulder surgery or a severe shoulder injury. In that case, check with your doctor first. For everyone else, shoulder rolls are a game changer. Now let us move to the fourth exercise, which is one of the most important for your hips and lower back. This is called the knee-to-chest stretch, and it is done lying down. Your hips and lower back are connected. When one is tight, the other suffers. And after 40, both tend to get very tight, especially in the morning. When you sleep, your hips stay in the same position for hours. The muscles around your hips, especially the hip flexors, shorten and tighten. When you wake up and try to stand, those tight muscles pull on your lower back and pelvis, causing pain and stiffness. This is why so many people over 50 say they feel like they need to warm up before they can move normally in the morning. The knee-to-chest stretch solves this problem in less than 2 minutes. Here is how to do it. Lie flat on your back on your bed or on the floor. If you are on the floor, use a yoga mat or soft surface. Bend both knees and place your feet flat on the surface. Now, slowly lift your right knee and gently pull it toward your chest with both hands. You can hold behind your thigh or on top of your shin, whichever is more comfortable. Pull until you feel a gentle stretch in your lower back and hip. You should not feel pain, just a comfortable stretch. Hold this position for 15 to 20 seconds while breathing deeply. Then slowly lower your right leg back down and repeat with your left leg. Do this 2 times on each side. You can also do a variation where you pull both knees to your chest at the same time. This gives a deeper stretch to your lower back. Just be gentle and stop if you feel any sharp pain. A study in the Clinical Journal of Pain found that people who do this stretch every morning report a 25% reduction in lower back pain within 2 weeks. That is a huge improvement. for such a simple movement. This exercise is perfect for anyone with lower back stiffness, tight hips, or sciatica-like pain that shoots down the leg. It is also great for people who sit a lot during the day. The only people who should be cautious are those with herniated discs or severe lower back injuries. If that is you, talk to your doctor and ask if a modified version is safe. For most people, this stretch is incredibly safe and effective. The fifth and final exercise targets your hands and wrists. And I know some of you might be thinking, why do my hands matter? Let me tell you why. Your hands are involved in almost everything you do. Brushing your teeth, opening a jar, typing on your phone, holding hands with someone you love. When your hands start to get stiff, it affects your entire quality of life. And unfortunately, hand and wrist stiffness is one of the earliest signs of aging. Arthritis often starts in the small joints of the fingers and wrists. A study from the Arthritis Foundation found that people over 50 who do daily hand and wrist exercises have significantly less arthritis pain and better grip strength than those who do not. This exercise is incredibly simple, but it works. Here is what you do. Sit comfortably in a chair, with your arms resting on your lap or on a table. Start by making a fist with both hands, squeezing gently but firmly. Then slowly open your hands and spread your fingers as wide as you can. Do this 10 times. Next, hold your arms out in front of you and rotate your wrists in slow circles. Do 5 circles in one direction, then 5 in the other direction. Finally, interlace your fingers and gently stretch your arms out in front of you, with your palms facing away from your body. Hold this for 10 seconds, then relax. This entire sequence takes less than 2 minutes, but it wakes up all the small joints in your hands and wrists, increases blood flow, and reduces stiffness. If you have arthritis, this can make a huge difference in how your hands feel throughout the day. Do this every morning, and if your hands feel especially stiff during the day, repeat it. This exercise is safe for everyone, unless you have a recent wrist fracture or severe hand injury. In that case, check with your doctor first. Now let us talk about how to put all of this together. These 5 exercises take about 7 minutes total. You can do them as soon as you wake up, right in your bed, or sitting in a chair. You do not need any special equipment. You do not need to change into workout clothes. You just need to commit to doing them every single morning for 7 days. Here is what I want you to do. Start tomorrow morning. Set your alarm 5 minutes earlier, if you need to. When you wake up, do not reach for your phone. Do not rush out of bed. Just start with the ankle circles. Then move to the cat-cow stretch. Then shoulder rolls. Then knee to chest. Then finish with your hands and wrists. Move slowly. Breathe deeply. Focus on how your body feels. In the beginning, you might feel stiff or tight. That is completely normal. But within 3 to 4 days, you will start to notice a difference.